Hello, everyone, and welcome to Question Lab. We're happy to have you here tonight as we dissect questions on the topic of neurology pharmacology. Leading tonight's discussion one more time is Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went back to do medical school after that. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
And we're happy to have you here as always. We also have some wonderful panelists. We have Kate and Jeff, who you'll meet later. My name is Sean. I've been with RX Coach now for about 3 years, working with our coaches like Paras and students just like you to help you accomplish all of your academic goals. So with that being said, let's move on now to our first question of the evening. I know we mentioned RX Coach. We're going to talk more about RX Coach later. What you should know for now, though, is that the methodology we're going to employ tonight is very similar to what we do in our coaching sessions. Question 1. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question. So I've gone ahead and covered those up. Once we cover those up, we move on to the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking prior to reading that vignette. This way you don't have to reread that question and waste time and can pick up on all those relevant clues your first go around. So let's go ahead and read that lead-in now together. Which of the following best describes what beta blockers should be avoided in this patient? Which of the following best describes what beta blockers should be avoided in this patient? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require. An example of a one-step question is when you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. And the reason why we ask you that is because we want you to have an organized thought process so that you don't make any careless mistakes and that you answer the right question on test day. So I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. All right, I see some responses coming in. Let's go ahead and read that vignette. A 32-year-old man is brought to the emergency department after being found wandering, apparently delirious and agitated. The patient becomes diaphoretic and tremulous. Temperature is 39 degrees Celsius, 102.2 Fahrenheit, pulse is 102 per minute, and blood pressure is 163 over 100. On examination, the patient has dilated pupils and ulcerations of his nasal septum mucosa with the residue of a white powder along the nasal alley. Which of the following best describes why beta blockers should be avoided in this patient? I want all of you to start thinking about the important clues in the vignette as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so starting off, we generally are given demographics. And in this case, we're given that this is a 32-year-old male. So, you want to make note of that because that can automatically start to clue you in on what you should be thinking about, okay? And then a lot of times, the next thing they're going to tell you is why are they coming to see the doctor? Why are they in the emergency room? And in this case, it's because the patient was wandering and delirious and agitated. So you want to make note of what those presenting signs and symptoms were that brought them in to be seen. A lot of times, not in this situation, but they'll tell you how long it's been going on for, a few hours, a few years, so you can get a sense of the chronicity of the condition, okay? Now, in this question, they also tell us a little bit more about physical exams. And obviously, we know this is a neurology topic, but we also know that we're dealing with pharmacology. And when Sean read that question, there are some important things there, vital signs, heart rate, blood pressure, physical exam findings, that you want to make note of. That can be very important. And then obviously the very last sentence is kind of a specific clue there, okay? We'll kind of talk about that. as well at the very end. So now they're asking us, why beta blockers should be avoided in this patient, but also what best describes that reason why. Okay, so I think we've got a couple steps. I think one, we've got to figure out what's going on with this patient, what's the overall condition, situation, and then two, why in that situation would you want to avoid beta blockers? Okay. Now, of the answer choices, we may need to pick one that best describes that reason. Okay, but I think we have a nice two-step question here. So let's go ahead and let's go through those answer choices. And when we work with students, we actually recommend that as they go through these choices, that they start at the bottom and they work their way up to the top. So start with answer choice E and work your way up to answer choice A. And the reason we do that is because a lot of times we'll see students who start at the top, they'll see something they like and they'll select it without having gone through all the choices. So sometimes they'll get that questions wrong as a result. So we recommend doing it this way to avoid from biasing yourself. So let's go ahead and let's do that now. Answer choice E, worsening hypertension. D, increased risk of ventricular arrhythmia. C, increased dopamine-mediated vasospasm. B, hypotension. And A, dyspnea. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we will talk about it in just a few seconds.
Excellent. The poll is open, and we're going to wait until about 2/3 of you have responded before moving on. Remember that there is no penalty for guessing on test day. You should never leave a question blank. And if you're unsure tonight, don't worry. Take your best guess, and then we will explain the correct and incorrect answer choices here in just a few minutes. I see the responses coming in. We'll give all of you a few more moments here. Keep in mind that we do have a special offer and a raffle. For one lucky winner is going to get a very valuable prize. Make sure you stick around until the end because you must be present to win. All right. Let's take a look and see what all of you selected. It was close. 36% of you selected increased risk of ventricular arrhythmia, and 35% of you selected worsening hypertension. So let's take a look and see what the correct answer is. And the correct answer is E, worsening hypertension, and 35% of you got it right. So great job. Definitely a tough question. Let me hand it off to Boris.
Thank you, Sean. Yes, great job, guys. So let's take a look at what's going on here, okay? So this patient, hopefully you guys were able to pick up on, this white powder residue along the nasal alae and ulcerations of the nasal septum mucosa, likely getting at cocaine use, okay? So this patient's likely using cocaine. And as we know, cocaine can cause dilated pupils, okay? If we take a look at the next slide, what you'll see here is a little bit of information on cocaine use and its role as a sympathomimetic, okay? So it is a reuptake inhibitor and it causes vasoconstriction, okay? It's a sympathomimetic that causes vasoconstriction. So if you give a beta blocker and you block the beta receptors, the only receptors that are open to be agonized are your alpha receptors, specifically your alpha 1. And as we know, that can lead to more vasoconstriction and thus increased in blood pressure, okay? So giving a beta blocker in these patients can lead to increased blood pressure. So that's why answer choice E was the best answer here. Now the other answer choices in this question, increased risk of ventricular arrhythmia is not something associated with beta blocker use. Increased dopamine-mediated vasospasm, also not something associated with beta blocker use. Hypotension, that would actually be the opposite. We would get more hypertension in this patient. And then lastly, dyspnea. So beta blockers can cause some pulmonary complications like bronchospasm and dyspnea, but usually you would want a patient to have some sort of history of asthma or other pulmonary issues, not something that would be caused by cocaine. So the best answer choice here, like you guys selected, is worsening hypertension.
Well, thank you very much, Boris. Great explanation. Great job, everyone. Let's move on now to our second question on NeuroPharm. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following medications was this patient most likely additionally prescribed? Which of the following medications was this patient most likely additionally prescribed? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require, and then we'll move on to the vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 33-year-old woman comes to the physician having had a seizure the day prior. She says she has abnormal taste in periods of unconsciousness followed by generalized tonic-clonic movements for 2 minutes. She was diagnosed with epilepsy 1 year ago and is taking lamotrigine. In addition to this most recent event, she has had 2 seizures while on medication. Physical examination is normal. She is started on an additional anti-seizure medication that binds voltage-gated calcium channels. Which of the following medications was this patient most likely additionally prescribed? Boris.
Thank you, Sean. So now we have a 33-year-old woman. So you want to make note of that, okay? And she is coming to the physician because she actually had a seizure. And they do give us a little bit of timeline. They said the seizure actually happened the day before, okay? Now, anytime you have a seizure, you definitely want to make note of how is the patient doing before the seizure, during the seizure, and after the seizure, okay? So we are told a little bit about that. We're told about how long some of those movements were going on for. You definitely want to make note of that, okay? Now, we're also told about some previous medication she was on, and then they're telling us about a new medication that she's being started on. That's an anti-seizure medication or anti-epileptic. And this question, when you went through it with Sean as he was reading it, you could tell this was possibly going to be just a one-step question. I think we've got to figure out, we're given a sentence there about a medication that started and its mechanism. So we've got to figure out what that medication is. They're not asking for the mechanism of that medication, just what that medication is. So I think we have a nice one-step question here. So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and work our way up to the top. Answer choice E, valproic acid. D, pregabalin. C, phenobarbital. B, clonazepam. And A, carbamazepine. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you, Boris. The poll is open. Once again, we're going to wait until about 2/3 of you have responded before moving on. Next week's topic is physiology. We hope you can join us. All right, see some responses coming in. Looks like there's a clear favorite so far, but let's see. All right. A few more moments here. All right, well, let's take a look and see what you selected. It was close, kind of. Valproic acid in first place with 35%, and in second and third place are pretty close, carbamazepine, followed by pregabalin. So let's take a look and see what the correct answer is. And the correct answer is D, pregabalin, and 24% of you got it right. So definitely a tough question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question. So, this kind of comes down essentially to what medication is this question on, okay? And if we take a look here at the next slide, this is kind of talking about pregabalin, okay? And pregabalin, I think we have gabapentin here, but pregabalin is a similar mechanism to gabapentin, okay? And it inhibits voltage-gated calcium channels, and it's a GABA analog just like pregabalin, okay? You can see there that it's used for epilepsy. So if we go back to our question, and you see a question that talks about an anti-epileptic binding to voltage-gated calcium channels, you would want to be on the lookout for a GABA analog, whether it's gabapentin or whether it's pregabalin. Okay, that's definitely something that you would want to be on the lookout for. Valproic acid, that blocks voltage-gated sodium channels. Phenobarbital and clonazepam both bind to the GABA receptor. And carbamazepine binds to voltage-gated sodium channels as well. So if you didn't know that what pregabalin's mechanism was, but you happen to know what the mechanism of the other answer choices were, that's another way you could have potentially gotten to this question as well. But a nice mechanistic epilepsy seizure question here. I will pass it back to you, Sean.
Well, thank you, Paris. Let's talk briefly now about RX Coach. So we mentioned RX Coach earlier. You met Paris. We've got a whole team of wonderful coaches that are highly trained and certified by us. We really do hire the best of the best, right? We've been in business for 30 years, and we have access to the best folks, and we have a really, really strict interview and hiring process. And so all of our coaches are wonderful. What our coaches do is work with you individually to help you accomplish your academic goals. What do I mean by that? Well, if you're in medical school studying for your block exams or subject-based exams, we'll look at your syllabus, we'll look at your learning objectives, we'll look at the resources you have, we'll give you all of ours, of course, and we'll come up with a learning and personalized schedule for you based on your learning style, right? So, you can go on Reddit, you can go on USMLE forums and ask your friends even, and everybody will give you advice and read advice online, but everybody's different, right? So what worked for one of your classmates may not work for you. So what we do is look at you, assess you, and then make you a study plan that will be efficient and effective, right? If you're studying for board exams, we'll base it on one of our assessments and we'll provide that to you. We're one of the only tutoring companies that was actually in medical education before we started tutoring. Our founders authored the book First Aid. They developed resources like USMLE-Rx, which includes our question bank, our videos, our flashcards, our bricks, and you'll have access to all of that. But because we have authored all these resources, not only do you get access to it, you also get access to a team of people who have a lot of data that they can use to really put you on the right path. Students always come to us and tell us, once I started using RX Coach, my studying became more efficient. I started reaching my goals in faster increments of time. And that's what we want. We want you to get to where you want to be, save time doing it, and take the guesswork out of studying. So you're not guessing, hey, I'm going to try this one, maybe this will work, or maybe this will work, or maybe this will work. Throughout this journey and help you become the physician you've always dreamed of. So if you're interested in having our help, reach out to us at rx-coach.com or rx-coach.com. Click on that free consultation button so we can talk about the program and see if it's a good fit for you. All right. Once again, that's rx-coach or rx-coach.com. So let's go ahead now and get into our third question of the evening. As you can see, the answer choices have been removed. Once again, that is by design. And we will begin with the lead-in. Which of the following medications is the most appropriate anti-epileptic medication to add to her regimen? Which of the following medications is the most appropriate anti-epileptic to add to her regimen? I'll give all of you a few moments to respond in the question box and let us know how many steps you believe the question will require. Then we'll move on to that vignette. All right. I see some responses coming in. Let's take a look at that vignette. A 6-year-old girl is brought to the emergency department after a seizure. She has known epilepsy and currently takes valproic acid. 3 previous monotherapy regimens have failed to treat her epilepsy. Which of the following medications is the most appropriate anti-epileptic medication to add to her regimen? Boris.
Thank you, Sean. So now we've got a young patient, a pediatric patient, and you can tell there that this is a much shorter vignette, okay? So it's going to be a lot more focused, but that means you're going to have to pick up on those clues there and really know what's going on. So as you can tell, Sean, when he first read that sentence, this was asking again about a medication that we're going to add, okay? We are told that she takes anti-epileptic medication right now, and she's been on 3 regimens before, and they've all failed, okay? It sounds like she's coming in again because of a seizure. So now they're asking us about what medication is the most appropriate anti-epileptic medication to add. So I think, it kind of depends on how you're looking at this. I think this could be a one-step question what medication are we going to add to this patient that we know about? I'm not sure if the answer choices are going to have another step in it, but it might just be a one-step question. So let's go ahead and let's take a look at those answer choices. And what we have here are 5 answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, phenytoin. D, levetiracetam. C, lamotrigine. B, felbamate. And A, carbamazepine. So we're going to go ahead and open up that poll. Go ahead and select what you think is best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paul. I'm going to open that poll up right now. Select what you think is the best answer. And once again, wait until about 2/3 of you have responded. Keep in mind that we do have that raffle and special offer coming up after our next question. And next week's topic is physiology. We hope to see you here. All right. I see the responses coming in. Give all of you a few more moments here. Once again, if this is your first time attending, we'd love to hear from you, so please do let us know. All right, let's take a look and see what you selected. 31% of you selected answer choice D. I'm just gonna leave it at that before I butcher it. And then second and third place are pretty much tied. So we've got 24% of you selecting lamotrigine, 23 at phenytoin, and 22 at carbamazepine. So let's take a look and see what the correct answer is. And the correct answer is indeed D, and 31% of you got it right. Let me hand it off to Paris.
Thank you, Sean. So let's go ahead and let's take a look at what's going on with this question, okay? So nice job picking up on this, but this patient, as you can tell, has been having some difficulty getting control of her epilepsy, okay? And she is on currently valproic acid, okay? Now, one of the key things here is picking up that this lead-in is asking us about a medication to add, okay? Not necessarily to switch with valproic acid, but to add on to valproic acid. So if you're going to add on a medication to another medication, you need to be on the lookout for potential drug-drug interactions, okay? Now, if we take a look at the next slide, we'll actually kind of flip it up and we'll kind of start with the other answer choices, okay? So valproic acid, you can see there, okay? It does cause or does have CYP450 inhibition, okay? So valproic acid inhibits P450, okay? It is also potentially can cause liver damage. It is a medication that can be hepatotoxic, okay? So we're going to keep that in mind. Lamotrigine was one other answer choice, okay? But that is a medication that is actually inhibited, metabolized hepatically. So maybe not the best answer choice there. Let's go to the next slide real quick. And there are some of the other answer choices. So carbamazepine, you can see there that this is an inducer of CYP450. So a little bit of a CYP450 interaction. It's also potentially hepatotoxic as well. Phenytoin, also an inducer or a player of CYP450, okay? So you also want to be careful with that, okay? So if we come back and go to the previous slide and we look at levetiracetam, we can see that this actually has a much more favorable side effect profile, okay? So this could be a medication that you might be able to add onto valproic acid and not have those concerns about increased hepatotoxicity or CYP450 interactions. So that's another thing that they were likely getting at with this question. So if we go back to our question, and one other point about felbamate. Felbamate can actually increase the toxicity of valproic acid, so also not a good option. But if you take a look at this question, one of the nice things to do in certain situations is take a look and be like, okay, well, if I'm adding a medication onto another medication, maybe they're asking me about, is it safe to do so? So instead of worrying about necessarily the mechanism here or which one is indicated as like a second add-on therapy, make sure you're thinking about, are they safe to take together? Are there any drug-drug interactions going on? And that can really clue you in. You know, if you weren't picking up on what's going on in this question, that could potentially clue you in as well. So don't forget about those drug-drug interactions.
Excellent. Thank you very much, Boris. Let's move on now to our last question of the evening on the topic of neuropharm. Once again, we'll begin with the lead-in. Which of the mechanisms and location of action combinations best fits this patient's medication? Which of the mechanisms and location of action combinations best fits this patient's medications? We'll give all of you a few moments here to let us know how many steps you think this question will require, and then we'll read that vignette. All right, I see some responses coming in. Let's go ahead and take a look at the vignette. A 60-year-old woman recently diagnosed with colorectal cancer has severe nausea and vomiting after each course of chemotherapy. To reduce her symptoms, she is treated with a medication that blocks the central nervous system receptor for substance P. Which of the mechanisms and location of action combinations best fit this patient's medication? I'll give all of you a few seconds here to respond. As we already did that, I'll give you a few moments here to think about what's important in the vignette and lead-in as I hand it off to Boris.
Thank you, Sean. So this is, kind of our last question where we're kind of showing you, what we think are those important clues in the vignette and the lead-in. Okay, so we've done this a few times now. So, hopefully you guys are starting to get a sense of, what are those important clues that you need to be picking up on? And when you have a pharmacology question, what kind of things do you need to be thinking about? Like our last question with drug-drug interactions, okay? So let's take a look at what's going on here. We've got a 60-year-old woman, and they told us that she has severe nausea and vomiting after chemotherapy. They told us the chemotherapy is likely for colorectal cancer, okay? She was started on a medication for this, and we were told about the mechanism of that medication, okay? Now, this question is then asking us kind of almost like a pairing question. So a mechanism and location of action of this medication. So one, I think we've got to figure out what is this medication they're talking about. Two, what is the mechanism of action of that medication? And three, what is the location of action of that medication? And then we've got to kind of pair those together to see where which one fits the best. So let's take a look at our answer choices and let's see kind of what they're getting at here. So a few steps here. So you can kind of see here now we have a list of mechanisms and we have a list of locations of a list of different locations of where this could be acting. So let's go ahead and let's kind of walk through those one by one. Answer choice E, neurokinin 1 receptor antagonist, working primary location in the GI tract. D, a neurokinin 1 receptor antagonist, working in the area postrema. C, a D2 receptor antagonist, working in the area postrema. B, a 5-HT3 receptor antagonist, working in the area postrema. And A, a 5-HT3 receptor antagonist, working in the GI tract. So we'll kind of hang on the slide for a second, let you guys take a good look at this, and then we'll go ahead and open up that poll. It's just the poll is just the answer choices, so make sure you're getting a good look at this table here, and then we'll let you select what you think is the best answer. We'll talk about it in just a few seconds.
Excellent, thank you, Boris. I'm gonna leave this up for just a few more seconds here, so you can get a good sense of what these choices are saying. Then I'll open up that poll and you can select A through E. All right. Well, hopefully that's enough time for you to pick your answer. I'm gonna open up the poll now. It's our last question of the evening. Let's try to finish strong. And of course, we do have our special offer and raffle coming up here shortly. All right. See the answer choices coming in. Give all of you a few more moments here. All right. Looks like that's about 2/3 of you. So let's take a look and see what you selected. Looks like 47% of you selected answer choice D, which is neurokinin 1 receptor antagonist and the area postrema. And 23% of you selected answer choice B, which is a 5-HT3 receptor antagonist and also area postrema. So let's take a look and see what the correct answer is. And the correct answer is D, and 47% of you got it right. Our strongest showing of the evening. Great job, everyone. Let me hand it off to Boris.
Thank you, Sean. So great job with this question, guys. Definitely a tough question here. So, let's take a look at what's going on here. This is a medication that is blocking essentially substance P activity. So let's take a look at that next slide. And this is a medication, one of the medications called Pregabalin, and this is a NK1 receptor antagonist. It's used a lot for chemotherapy-induced nausea and vomiting, okay? So this is likely what they're getting at with this question, okay? And if we go back to our question and our vignette, what this medication does as an NK1 receptor blocker is, the NK1 receptor blocker is essentially what substance P binds to. So when it says that this medication blocks to the CNS receptor for substance P, that's getting at a medication that blocks NK1, for example. Okay, so this is a medication that is that they are getting at, and as you can see, that would be either answer choice D or answer choice E based on mechanism alone. Okay. Now the better answer choice for primary location of action is the area postrema. Okay, this is one of the areas involved in what we call the chemotherapy trigger zone. Okay, so if you have activity in that area, this is responsible for initiating that nausea and emesis in the chemotherapy zone, which includes the area postrema, and that's within the CNS as well. So that is a much better answer choice in this situation than the gastrointestinal tract. Okay. The other answer choices, answer choice D, for example, that mechanism describes a medication like prochlorperazine, but again, that is not a substance P receptor blocker. And then answer choice A and B, that mechanism is getting at a medication called ondansetron, which is also used for chemotherapy induced nausea and vomiting, but is not consistent with the mechanism in this vignette. So like you guys picked, the best answer choice here is answer choice D. So great job on tonight's questions, guys. I will pass it back to you, Sean.
Well, excellent job, Boris, as always. And great job, everyone. We had a lot of challenging questions today, but you guys really rose up and met that challenge and did quite well, and hopefully learned a lot from Boris's wonderful explanation. So if you want to study these questions more, just to make sure you've mastered this material, please make note of these question IDs. You could take a picture, write this down, take a screenshot, and then simply go into the RX question bank, type this into this RX search field, and it'll pull it up so you can take a deeper dive. So I'll leave this up for a few more seconds for you to make note.